Patient family-centered care is very important to me. So I think when patients and their families come to see me in the clinics, for example, they will find that I spend a lot of time getting to know them and understand them. And many of the patients I see have very complicated histories, not just their medical history, but other aspects of their lives which affect their care. And so spending that time up front to get to know each other and then develop a collaboration together, myself, the patients, our nursing team, their families, as we come up with a plan to help understand their health, their wellness, and the needs that brought them to our clinic are critically important. And it's very satisfying when I hear back from them later, wow, you're the first doctor who spent this much time with me and really got to understand me, and that's remarkably rewarding. I wear multiple different hats. And so in addition to taking care of patients with inflammatory bowel diseases, I've developed an expertise, and I'm fortunate to lead the program of our small bowel disorders, where I perform capsule endoscopy and double balloon enteroscopy. I can think of more than one patient who's had a story that's been very suspicious for Crohn's disease of the small bowel, for example, and where at other institutions, despite best efforts, they weren't able to help make this diagnosis. And with the skill set that we have, the collaborative team that I'm part of, and the unique things I'm able to contribute to this institution, we're able to help make the diagnosis of Crohn's disease with deep small bowel enteroscopy or double balloon enteroscopy, obtain biopsies, which would change our recommendations for therapy for this patient and move them on to getting better. And in this particular patient, I was able to follow up with certain procedures to help avoid surgery by dilating strictures of their small bowel. And that's particularly satisfying because I knew that elsewhere they might not have had these opportunities. I really felt that I was part of that Michigan difference. What the Michigan difference means to me is that opportunity to spend time with the patients, to talk to them, to talk to their families, to get their history, to piece together their complicated evaluation elsewhere, to formulate a plan with them, and perhaps with other colleagues and other specialties, to all work together as a collaborative team to understand, manage, and help them through their disease process that brought them through here, and then getting them back to their own life to do the things that they want to do.